Welcome to the presentation today. My name is Lucy Gross, and I own Alta Vista Benefits, which is a Columbus, Ohio independent agency for Medicare and under 65. Today we're going to talk about preparing for annual enrollment, which is coming up quickly, October 15th to December 7th. We're going to understand key documents that you're going to receive and when you're going to receive them, how to know what your rights are in terms of appeals and other things, and also how to make informed coverage decisions for the following year. Okay, the first thing we're going to talk about is the Annual Notice of Change, also called an ANOC. The importance of the ANOC is that it has changes for the upcoming plan year clearly outlined that is sent to you by your insurance plan every year. It helps you decide if your current plan still meets your needs because it does a comparison, which we will see in a moment, by column of what it is now versus what it is for the coming year. This is a critical tool for the annual enrollment period, which begins October 15th and ends December 7th. So when does the ANOC come out? It's only sent to Medicare recipients that have a Part C or Medicare Advantage plan, or to people who have a standalone prescription drug plan. Original Medicare beneficiaries receive the Medicare and You Guide instead, and those are people that have a drug plan with a Medicare supplement. The reason you get that is that Medigap federal standards do not change annually. Typically the deductible does, but the plan itself does not. The ANOC is usually mailed by September 30th of each year, and it covers changes effective January 1st for the following year. If you have an online portal through the insurance company, you may also be able to get a copy through your plan portal. So what to look for when you get an ANOC? Well, first of all, the premium of the plan can change. It can go up and it can go down. So you want to make sure you understand what the premium is doing for the coming year. There are also benefit changes. Reduced services can happen, added services can happen, and again, that ANOC shows you in detail what changes are being added or reduced. Formulary tiers can change. In other words, a drug that is now Tier 1 can be Tier 2 and vice versa. Copays or coverage changes also can be explained in the ANOC. And then network changes. And for those of you who are not aware, pharmacies are a network both in Medicare Advantage and drug plans. Those are network pharmacies and standard pharmacies. Then doctors and hospitals can also change in the new year. Here's what is included in an ANOC. First of all, you have a summary of important costs, changes to any benefits, and this is a fairly lengthy document, so there could be a few changes. Then prescription drug coverage changes and next steps. So here's what two examples of an ANOC look like. The one on the left is for a prescription drug plan, and the one on the right is for a Medicare Advantage plan, and it would look the same if you had Medicare Advantage or Medicare Advantage with a prescription drug plan. You just would not have the prescription drug plan details in the one that is just for Medicare Advantage. So let's look at the one for the prescription drug plan. It shows this year and next year, both circled in red in this example. The premium is $15.70 this year, going to $65.70 for the next year. This is very important because this actually happened, and I had a number of phone calls about this because people said, well, I didn't know about this. This is how you find out. Agents don't call and let you know this because you are notified by the insurance company. Then if you look at the next line, it's the Part D prescription drug deductible. In this case, it didn't change, but the coverage underneath the hood did change in terms of what the copays are for the drugs. Very important to review that. Then if you look at the example for the Medicare Advantage plan, the monthly premium didn't change, the deductible did. It's now $300 except for insulin furnished through durable medical equipment, or in other words, an insulin pump. And also, if you look at this example, the maximum out of pocket changed from $87.50 to $92.50. You're going to want to know that if you're making a decision about coverage for the coming year. There is also a document called the Evidence of Coverage, which is much more detailed than the ANOC. The ANOC is a summary of changes. It is in detail, but it's a summary at a higher level. It's sent annually before AEP. The Evidence of Coverage is a much bigger document. It is a detailed prescription of all benefits, and you can take those two documents and lay them side by side and really understand what coverage changes are happening. This is sent annually and must be received by the Medicare recipient by October 15th. And the insurance company may send it together with the ANOC, or it could be a separate mailing. So let's talk about appeals. What is an appeal? It's a request to review denied coverage or a payment decision, and it allows you to challenge the insurance company for decisions that they make regarding your plan. When you should file an appeal is when a service or medication is denied, a payment is refused or reduced, coverage ends too soon, or you disagree with the plan's decision. And it could be a decision about a claim. It could be any kind of decision that the plan makes. How do you file an appeal? An appeal has to be a written request submitted to your plan. You must follow the deadlines that are required by the plan, which is typically within 60 days of the denial. You must include supporting medical documentation. And if it is medically urgent, you can request an expedited appeal. So what do you do if an appeal is denied? You can request a second level appeal. You can ask for an independent review, and you can continue through multiple appeal levels if you need to do so. Where can you get help with appeals? Customer service, which has a phone number on the back of your card. They are always available to help you with this sort of thing. Medicare, 1-800-MEDICARE, you can call them and ask for assistance. The State Health Insurance Assistance Program, SHIP, can also help you, and you can contact your agent. Your agent will help you with this too. So now let's talk about why it's important to keep your addresses updated. Typically, people move in their lifetime multiple times. And so if you're on Medicare, it's important that you contact your insurance plan when you move. You also need to contact Social Security Administration and potentially Medicare. Why this is important is because your address is key to ensuring that you receive important documents like the ANOC, like the ID cards, like billing notices. I can give you examples of a number of people who did not read their ANOC. They did not get the bills because they had not updated their address, and they end up losing coverage. So this is very important that you keep your address updated. It also ensures that the insurance company maintains accurate plan records, and it keeps you in the provider network that is correct for your address. Plans are location-based. Specifically, Medicare Advantage and drug plans are location-based. And moving can affect the plans available to you. It can affect the provider network in the area. It can affect rates for the premiums. And you may qualify for a special enrollment period if you move, depending on what the circumstances are. So you want to make sure that you don't miss any deadlines or important notices, that you don't miss any important billing that you get. If there are claims, they come to your residence so that you know that you have had a claim processed and you can determine whether or not it was processed correctly. So let's talk about enhancing your coverage. There is a supplemental set of benefits that you can get, especially for Medicare Advantage plans, to help you fill gaps in coverage. These plans provide financial protection, and they also offer additional peace of mind. The first one is the hospital indemnity plan. It pays a set cash benefit directly to you for hospital stays. And in a Medicare Advantage plan specifically, there are deductibles and copays for hospital stays. So these plans can help you cover those deductibles, copays, and other expenses that occur while you're hospitalized. Again, this is paid directly to you. The second example is a short-term care or recovery plan. This is designed for temporary recovery periods, and it helps people that have not made the decision to do long-term care insurance. It also supplements long-term care insurance if you have it. It helps with home health care, skilled nursing, and rehab services. So let's summarize what we talked about. It's important to review your ANOC carefully every year. If you have questions, you can always call our office. We will help you review your ANOC. You need to understand your appeal rights and what the timing of appeals are. Keep your address updated at all times with the insurance company and with Medicare, and consider adding supplemental products for additional peace of mind and financial protection. If you have questions, my contact information is on this screen. You can contact me at my office or by email. I rarely answer my cell phone during the day because I'm talking with customers, but I will return phone calls to my cell phone when I get a moment. So review your plan annually, ask questions early during annual enrollment, and work with a licensed professional to help you with your decisions. Thank you for your attention. Again, my name is Lucy Gross, and thanks again.